All right, go ahead, Mayor.
Good morning. Welcome to the Mayor's Breakfast, July the 10th. This is our 14th edition of doing the Zoom conference for the Mayor's Breakfast, and I so appreciate everybody joining us. I think today's program is going to be really informative. Our last broadcast was 2 weeks ago, and there's been some changes in the situation with COVID, and we'll be getting some, I think, excellent updates, both from our city manager, from our county supervisor, Andersen. Welcome aboard, State Senator Stephen Glazer, who will give us a perspective on the state level. And then, of course, at the end is always our dessert, which is the Dr. Joseph giving a wrap up, and he'll be doing a presentation on what's going on. And so I'd like to start this by first turning to our city manager, Joe Gorton, for any updates on the city stuff.
Thank you, Mr. Mayor. Just as usual, to give as much time to our guests as possible, I'll give you just a couple of updates. I'd like to highlight our San Ramon Business Assistance Program that we initiated. So far, we have a total of 40 businesses signed up for the program. Participants can sign up for free. The only requirement is their business must be located in San Ramon. Once signed up, the businesses receive one-on-one assistance with loan applications, reporting requirements, and any other questions related to state and federal funding opportunities. The 40 businesses represent about 540 employees in San Ramon, and to date, participants have received what we've confirmed about $3 million in federal funding. On Saturday, the president signed a bill that extended the Paycheck Protection Program application deadline to August 8th. Approximately $130 billion is still available in that. Last week, the SBA released a detailed loan level information for the loans made to date, and approximately 4.9 million loans have been issued so far. A total of 1,600 PPP loans were issued to San Ramon businesses, representing just over half of the businesses in the city. So our San Ramon businesses are taking advantage of it. So that's great to hear. Also, you're probably aware that the CARES Act funding, the governor and the state legislature, possibly Senator Glazer will discuss that a bit, but that is announced a budget that includes the distribution of $500 million in CARES Act funding, and the city has applied for that CARES Act funding, and we expect, San Ramon expects to receive approximately $1 million from that funding. So we're very happy to get some of that relief as well. And with that, I will turn it back to you, Mayor, to move on to our other guests.
Sounds good. Every week we have been blessed with our county supervisor, Candace Andersen, to give us an update from the county. It's been 2 weeks. There have been some changes and movement going on with COVID. So before we introduce the state senator, give us an update on how things are going locally.
I'd be happy to, and I want to thank the city of San Ramon for your great response and great participation as a partner as we address COVID. So 2 weeks ago, when I was back with you in the countywide, we were just over 2,500 cases. We have increased in the last 2 weeks close to 1,800 more cases. We saw a 69% increase in cases over the last 14 days. Interesting, the largest age group right now who are coming down with COVID are those who are in the 21 to 40-year-old age group. We are averaging right now about 146 new cases each day. Now, 2 weeks ago, it was 68. And because we are doing more testing, we're encouraging everyone to continue to be tested, although there are some delays, and I'll talk about that in a moment with getting results back. We are still seeing what's very disconcerting is the positive case count. Ideally, if we were doing more testing, we would expect to see sort of the same percentage. When I was here 2 weeks ago, about 3.9% of everyone who was tested was in fact positive. This week, we're averaging 7.6% of those who are testing, positive. Virus is spreading in your community, the city of San Ramon. In 2 weeks, since I was here last, you have almost doubled the number of cases that we've identified in San Ramon. 2 weeks ago, you were at 55 cases. Today, you're at 109 cases. And we are also concerned significantly over the hospitalizations. And so in early June, when I was talking to you nearly a month ago, we were averaging just 13 people in the hospital. And we do a seven-day average. When I was here at the end of June, we were at 37. Yesterday, we were at 54. And in a morning briefing I was just on, it's possible that we'll see us in the mid 70s of hospitalizations today. Fortunately, not as many are ending up in the ICU. Currently, we do have ICU capacity. We currently do not have any state prisoners. San Quentin, as you know, they've had a horrible outbreak. Those prisoners are going to Bay Area hospitals. None are located in our hospitals at this time. And we do have, we think, 4 or 5 individuals who may have come through a mutual aid agreement we have with our county emergency medical system from Southern California, where they're seeing a huge impact at their hospitals. Interestingly, we know that we have 10 to 15 of our Contra Costa residents hospitalized in Alameda County. And so that's something that we're watching very, very carefully. People still sometimes want to compare this virus to the flu. And yesterday, when I was on a call with our doctor in our weekly COVID ad hoc meeting, this came up. And so with our current deaths right now in Contra Costa, we're at 88 deaths. Our population of 1.1 million, we're at about 7.7 deaths per 100,000. Flu deaths is typically 0.8 or 4.2, within that range per 100,000. So already we're exceeding midpoint in the year, the flu rate by 2 to 3 times. And I think what people sometimes forget, and it's something I need to remind everyone, is because of your extraordinary efforts of sheltering in place, we averted a much, much more serious crisis. And so we use different modeling. The Stanford model is the one that we primarily use. It's estimated that through our shelter in place, through our quarantining of people who aren't feeling well, we prevented in our county alone over 4,000 deaths and more than 21,000 hospitalizations, just to keep that in perspective. Now, the spike in cases, as I had mentioned when I was here at the end of June, did in fact slow our reopening. There were several things that we hoped to reopen on July 1st. This is going to delay it at least 3 weeks. We are on the state monitoring list primarily because of our increase in hospitalizations. But now as we get very, very close to having that 8% test positive rate, that may also not only slow us down in reopening, but because of the attestation we made when we went ahead and started opening things up, once we hit that 8% level, it's very possible that we are going to have to roll back a few things. Right now, the health officer is talking about it with our county council. There may be new guidelines with regard to indoor gatherings, including religious or protests. Outdoor gatherings would still be allowed if in fact we reach that 8% and a new health order is issued. There may be new restrictions on outdoor dining. Not that you can't still have outdoor dining, but you might be required to wear a mask when you're not eating. So as you get up to go pay your bill, or as you get up coming in and out of the restaurant, get up to use the restroom, unless you're actually eating and dining, that may be a new regulation as well. And there may be some more clarity, stricter definition of what outdoor dining really should be based upon the state language, state ABC, alcohol beverage control. They have very strict regulations about if you're serving alcohol, it has to be with a meal. Some places are sort of handing you a bag of potato chips, might be something a little bit more significant. Enforcement is a big issue right now, and I know it's a concern of Senator Glazer. He and I had a great discussion about it last week, and I had a meeting this week with our sheriff, with our county health officers, with our district attorney to sort of talk about how are we approaching it in our community, in our county. Currently, most of the time, calls come into your local non-emergency police line, same with other cities. They come to the sheriff's non-emergency line. They come into my office, the supervisor's offices. They come to the health line, and some directly to the district attorney's line, as well in our environmental health, which oversees restaurants. And so what we're doing at this point, the district attorney has a very great process in place of intaking those complaints. They have dedicated staff of an individual, a paralegal, they have an attorney, they have 2 investigators, they have 3 other team members that then go out and investigate what those alleged violations are, primarily with businesses. They're not out investigating face coverings, those sorts of things. And they are now going to be working with the state. There is a multi-agency strike team that the state has formed. They have a direct contact in our DA's office. And this strike team is made up from staff with agencies like the CHP, Department of Consumer Affairs, Cal OSHA, ABC, Board of Barbers and Cosmetology. And their goal really is to ensure that everyone's playing by the same rules, that we have fair and equal enforcement. Other thing that we are looking at as a county, because it has proven effective, when you violate the health order, it's a misdemeanor, and a misdemeanor can involve a jury trial, it can involve a very lengthy process. And so some cities, some counties are looking at having administrative citations. We're looking into that as another potential tool in the tool belt. Again, not because we want to have these draconian measures, but we really want to keep the community safe. And this would give local police departments, it would give local health officers one more opportunity to help educate the public first. But if they are unwilling to follow the rules, then potentially to have some low-level violation that could be issued to help people understand how serious we are about this. Testing concerns. This is something I mentioned. We're doing more testing, but across the country, across the state of California, there are serious delays based upon not having all of the test reagents you need, staffing, where we were turning around ours through private labs in Contra Costa in 3 or 4 days. In some cases are taking up to 10 days. Problem with that, of course, is it makes our contact tracing so ineffective. If someone gets tested and they're not alerted for 10 days that they might be COVID positive. And so we're really working on this. We're talking to labs all over the country to try to get greater capacity, but it's not just a Contra Costa issue. It's not even just a state of California issue. It's a national issue as well. And then with regard to reopening schools, I'm just going to reiterate what I said last time. Our health officers are not going to tell any school district what to do. The school districts have guidelines, they have recommendations, but each school district is going to be making that determination. So that is my quick summary. I wish I had better news, but there's a lot going on, and stay tuned.
Thank you, Candace, so much. And you'll be sticking around. I'm sure there'll be some questions.
I will.
It is absolutely my pleasure to introduce to our San Ramon audience our state senator, Stephen Glazer. I've known Stephen probably for 5 or 6 years now, and I've got to say that you are one of my, and I have very few, favorite politicians on a statewide basis. You're a thoughtful guy. You are, from my point of view, a very nonpartisan, and you have set, I think, a great example of what good governance looks like in terms of those who are in the state legislature. And in fact, part of me wishes you might even think about running for governor someday, and you'd have my support. You do a great job, and I appreciate your thoughtfulness. We don't always agree on everything, obviously, but I do respect your due diligence and your representation. So give us an idea, Steve, of what's going on here on a statewide level, especially here with the COVID.
Well, thank you, Mayor Clarkson. Thank you for your great leadership in San Ramon. We've had a great partnership through the years, and I so appreciate it. I know it's made your community and our region a better place for your collaboration and your sage advice. And certainly Supervisor Andersen, it's always good to see you. You really exercise an extraordinary leadership, not just in Contra Costa County, but in our region. And I so appreciate all the diligence that you have applied to your work. Certainly in this COVID world that we're in, things can't be more difficult, and you've really stepped up in amazing ways. And I just want to thank you as well. I can talk about the Senate and the legislature, but I hope we'll spend more time talking about COVID, because it is the issue of our time. And it's unfortunately, we're not in a good place, and we could talk about that in more detail. But it's affected everything in the state, including the Senate. We've had an abbreviated session this year, only going back into session in May in very select ways to try to deal with just the highest priorities of issues facing our state. Some of those issues were areas of concern here in Contra Costa County, in particular, the public safety power shutoffs that we experienced last fall, for many areas of almost 8 days of shutoffs. And it created a lot of serious consequences that we trying to address through legislation. Cell towers went down, couldn't get notifications of emergencies, couldn't call out for help for many areas in Contra Costa. I have legislation in to mandate a 72-hour backup power at all our cell towers. Pleased to say that bill is in the assembly. We'll have a hearing in a couple weeks, hoping, fingers crossed, that we can create that mandate so that we can be sure that the lifeline, our cell phone service, will be there for us when times are most difficult. And when they shut off the power, there's the potential for fire. And that emergency situation requires our utilities and our telecommunications companies to step up, working hard to make that happen. One of the things that happened during the power shutoffs is that our hospitals have to run backup generators. Yet to do so puts them under threat of penalty by the air quality boards in our area. I have legislation in that would eliminate that risk, that penalty. That bill also got out of the Senate this last month. And finally, there's a select group of people, we call them baseline medical customers. And if you are one, you probably know, it's a determination with your doctor that if you don't have power, that your life is in jeopardy. And there are tens of thousands of people on that medical baseline list in our area. And they don't receive any extra care during these power shutoffs. I have a bill that would mandate that the power companies provide that select power for their device, whether it's a heart, lung device, electric wheelchair device, medicine, refrigeration, all the elements of life-saving. I have legislation to mandate that the utilities provide it. That bill also got out of the Senate last month, and it'll be heard hopefully in the Assembly this month. So that's on the legislative front of some note. Not easy to move bills now because we're only focused on the highest priority issues like COVID. But the fire season is here right now, folks. It's not August, September, October. It's right now. And unfortunately, it creates a lot of consequences. We're obviously putting pressure on the utilities to harden their system, PG&E to harden their system against wind events. But that's going to take time for them to act more responsibly. And so there are some serious issues we're trying to get in front of. And the fire season, I know the city's concerned about it. Mayor, I know you're concerned about it, Supervisor Andersen. And I have seen stepped up efforts in our region to cut down trees, clear fire safe areas, underbrush. I hope people that are listening are taking that very seriously. Not about getting a ticket from your fire department. We just need to protect each other. And we are only as safe as our neighbors around us. It's the same thing with COVID, right? If you're taking care of yourself, but your neighbor isn't, and you get in contact, you're affected. So we all depend on each other in so many different ways. And that's on a virus like this. It's also about fire. So I want to encourage everybody to look around you. A lot of neighborhoods are getting together and helping each other, by the way. So if you see a neighbor that maybe isn't doing what they need to do, maybe collectively getting together with neighbors and a fire safe council is a great way to help communicate, reinforce, support each other. Maybe they need some help cutting down some brush and you can step up, or another neighbor may be more capable of stepping up. But do think about that. This issue of safety is never more acute than what we're experiencing. We love the Bay Area. We love living here. And it's not just about earthquakes now, we know, right? There's so many other things out there that affect our ability to live in a healthy way and a safe way. So I share that with you. On the COVID front, things have really gone backwards, and Supervisor Andersen described that in detail for Contra Costa County. But for the state as a whole, it's the same and even worse, certainly down in Southern California. The outbreaks are severe, almost 10,000 new cases yesterday not last week, not last month, yesterday. Over 150 people died yesterday. And we've had great leadership here in the Bay Area to coordinate and cooperate among counties. To some extent, that's broken down as counties have deferred to the state's leadership. And that, in my view, hasn't been a good thing necessarily. But our public health officers have been very courageous. They're focused on public health. And I think, as Supervisor Andersen's indicated, we're going to have to retool, reset all the elements of how we move about safely under COVID. And that's going to make a lot of people really unhappy. But until we can get a handle on this virus spread, and the line is only going up. It's not going down. It's not plateauing. It's only going up. Until we can get a handle on this, everything that's important to us, our jobs, our businesses, our schools, everything is at risk. All these things go together. It's not one over the other. It's not the economy over health. They're all intricately linked. And so we have to do a better job. The politicians, the health directors, they can all make declarations, but ultimately it's about your behavior, my behavior, that's going to determine whether we can make that curve flattened. And so far we haven't been able to do it appropriately. That's just what it is. And every day we delay adds a day or more on the back end for when we're going to get out of this. We've seen countries around the world able to act responsibly, do what's necessary, and flatten their curve. Entire countries have 50 new cases in a day that they can track and trace and quarantine. In America, yesterday, we had 60,000 new cases. Think about that, 60,000. So it is out of control. And I know that's not good news and no one wants to hear it. But our job is to try to talk straight and figure out what we can do about it. And I look forward to that conversation this morning. I appreciate the opportunity, Mayor, to be a part of, once again, one of your wonderful breakfast conversations.
Thank you, Senator. And I'm sure there'll be some questions for you here at the end. He perhaps needs no introduction, but I will anyway. Dr. Patrick Joseph has been our resident expert. He is an expert nationally known for infectious diseases, and he has given a series of really thoughtful talks to us about the disease. And so, Dr. Joseph, I understand you want to share perhaps another slideshow with us this morning.
Yeah, well, I do. And thank you, Mr. Mayor, for the introduction. And thank you, everyone, for the participation. I learned so much, particularly from Supervisor Andersen and this morning from Senator Glazer. Just a lot there. And I share your thoughts completely. I'm going to try to share the screen. I know you always help me do this. So let's see if we can get this to work correctly. And there we are. So with your permission, a little bit of a potpourri from the medicine science side. And again, the same title slide, living with COVID in 2020, because that's what we must do. We have to live with this virus and learn how to live with this virus. It's pretty clear now that this is not quickly going away. I picked these 6 things that we'll touch on briefly in the next few minutes. What I've titled COVID fatigue, perhaps an overview from my perspective of what we are seeing now and why, the mortality rate that is being discussed and sometimes confusing the way it's being discussed. And I hope to put a little bit of my thoughts behind that. Some of the comments we're hearing about face coverings, staying healthy, a note about smelly hand sanitizer, because it's one of the more common questions that I'm getting now. So that will be a bit of a chemistry lesson. And then some new stuff about wastewater and how that may guide us in the future. So first, COVID fatigue. We are all getting tired. On this slide are just some highlights. We've been living with this now for 6 months. It was getting out of control quickly in other places. And in our area, we quickly understood that a stay-at-home order that was invoked on March 16 was one thing we wanted to do. And it was fantastic. It really, really worked. But that's 4 months ago. And I will put myself in the shoes of everyone in our community and in the country. We wanted this to go away. We didn't sign up for this to be a part of our everyday life, but it is. This virus is relentless. It is not slowing down. If we don't take rudimentary measures to prevent spread, it will increase. And we don't have a lot of opportunity to reduce spread. The stay-at-home order and then the face coverings that came in on April 17th remain our number one and number two way of controlling this virus. And when I talk about fatigue, it's very clear from walking down the street or from watching the news that we just got tired of doing this. We want to go out. We want to socialize. We want to go to retail. We want to go to parties. And look at what's happening in colleges and kids who want to date. And they've had enough. And the result of having enough is this surge that we are seeing, particularly in the 21 to 40 age group. This is not something that is analogous to a sea with repeated waves. It's much more analogous to a fire, a wildfire, that if you relax your efforts at controlling the wildfire, it will spread. A wildfire is relentless. This virus is relentless. And when I see people, and I see fewer of them than we might see in other parts of the country, not taking appropriate precautions, not socially distancing, not wearing a mask correctly, it's easy to understand what's going on. And I'm sure you saw the news last night that there were 40 some cases from fraternity and sorority parties in Berkeley. I believe this is understandable, but not acceptable. It's time that we emphasize that this is all we have. I don't want to say that science has failed us. Science hasn't. We don't have a cure. We don't have a protection. We don't have a vaccine. All we have is social distancing and masking. And that still works. And we have to emphasize that we go back to doing that and paying much more attention to being meticulous. So I put these numbers together last night. And the numbers on here are a 7-day rolling average. And I just wanted to show where we are compared to what's hitting the top of the news. And so the new cases per day, as was mentioned, there's about 60,000 new cases a day in the United States. Arizona, Florida, and Texas, and now California are being listed as the top 10. But I wanted to show how much better we are than those other areas where the fatigue factor has become greater. And that's in the right column. That is the new cases per population. That is the new cases per 1 million residents. And you can see that Arizona, Florida, and Texas are in trouble, but we're really doing well in California. So we're better than some parts of the country at maintaining what we need to do to protect it. We haven't relaxed. And as you probably know, and this is not a criticism, some of those states that are showing uncontrolled activity were the first to open bars, the first to open beaches, the first to have parties, the first to have rallies. And California, because of our political structure, was very hesitant to do such a thing, and we are reaping the benefits. And then if we take a look at our county, you can see that we are even better than the state. And Senator Glazer mentioned this. Southern part of the state is having problems. There are pockets, including incarceration areas, that are having problems. But our local community, we are really doing well, and we can do better. So I guess the message here is sometimes when things are out of control, it's easy to give up. But when you have control, it's easy to ramp up. And I really encourage all of us to ramp up. And that is, go back to wearing masks. Be meticulous about social distancing. It works. The thousands and thousands of lives that have been saved of disease that has been prevented by these simple measures is irrefutable. I want to talk a little bit about mortality because sometimes the news gives a message that is a little bit confusing. We know that although we're having more cases than ever, that our mortality rate is lower than ever. But it's a little bit skewed. Supervisor Andersen mentioned that not only in our local area, but nationally, the new cases are in the age group of 21 to 40. So that's where all the cases are occurring. And their mortality rate is very low. And their mortality rate is not going down, it's the same. Similarly, the mortality rate of a 70-year-old or an 80-year-old who gets this disease is not going down. It's the same. So quoting a decrease in the mortality rate is really quoting the age group of the new cases. And this is really important because I think this represents a lag effect. That is, if we have tens of thousands of new cases in the age group of 21 to 40, and fortunately the low hospitalization rate and a low mortality rate, it is going to spread to parents, to grandparents, to neighbors, to individuals where protective activity is not being maintained. I fear that if we don't start going back to what we know works, that our next surge is going to be on the right side of that slide. The younger people are going to get it and inadvertently, that is without symptoms, spread it to parents and grandparents, aunts and uncles and neighbors. And the mortality rate, again, of those above 60, of those above 70, is not changing. We are not seeing a decrease in a mortality rate by age group, but rather a decrease overall, which I think is a little bit skewed the way it's sometimes presented. Now let me put in a plug here. We know we're seeing a lot of cases. We know we don't have good medicine, a good antiviral medicine yet. But what this represents may be an opportunity for thousands of people to donate plasma. And I've said this here before, and maybe some of you already know it, but one of our most effective therapeutics for individuals who are in an intensive care unit, for individuals who are on a ventilator, is convalescent plasma. This is plasma that is donated by someone who has had the infection and recovered. They can go to the Red Cross. You can even donate plasma 2 or 3 times a week. It's not blood donation, it's plasma donation. So if there is a shining light through all of this, maybe if we encourage people, we will replenish our decreasing stock of convalescent plasma. As a community, when you know people who have this virus, if they are otherwise healthy, recommend to them, consider donating plasma, call the Red Cross. This can be an opportunity for all of us, and we don't want to miss this opportunity. So, as I said, what we have left for us now to change the shape of this curve, to go back to where we were, is adherence to social distancing and face coverings. And that takes me to the next slide. One of the, oh, by the way, I've tagged this, our new phrase is antivirus software. So this is the software that you put on your face to protect you from shedding viruses to elsewhere. And just a quick note, this works. Just believe me on this. We're looking at over 100 scientific, virologic, microbiologic studies that show that an infected person, with or without symptoms, if he or she wears a mask, protects others. As you walk down the street and you see somebody wearing a mask, they're wearing a mask to protect you in case They're shedding the virus and don't yet know it. And similarly, the reason you wear a mask or a face covering is to protect the people around you, to show the people around you that you care because you may be shedding the virus and not know it. So the mask protects people around you. And I bring this slide up because one of the most common questions that I get, since I have had to recommend people wearing masks for hours and hours at a time. So this would be in a retail facility. This would be in one of my laboratories. This would be in a hospital where an individual has to wear a mask all day long because they're face to face with people or because of their other circumstances, perhaps in a supermarket, perhaps in a CVS, the people who work there. And what I'm hearing is, I get so hot wearing these masks. I just can't take it. And I have to, every hour or so, I have to go take a break and let the mask off. And I understand that and I believe it. And it's a function of what is being worn. So any of us can wear any of these masks on here that are made of fabric for a short period of time. So if we're driving to a supermarket, we can put a mask on, go in the supermarket, come back to our car and take it off. They're fine. But for those who have to wear a mask for a prolonged period of time, the one that's in the middle, the typical surgeon's mask, is much cooler. It's a specifically designed mask that is very light, and surgeons have been wearing these for 100 years. They do capture exhaled virus. They do keep surgeons comfortable. They do keep nurses comfortable, and now they are available. 6 months ago, they were not available, but they are now widely available through every retail outlet or every online outlet. So I would say that if you're an individual who has to wear a mask for hours on end, and if you're uncomfortable, this represents an option. So that's my comment about face coverings. Doggone it, they really, really work. And every time I read a study or participate in a study, they work better. So these are very good. So next, staying healthy. These numbers are extremely important. So I'm going to leave them on and talk about these a little bit. This is what has happened in the past several months while we were participating in shelter in place, when doctors' offices were closed, when emergency rooms were overwhelmed, that individuals were not participating in routine medical visits. And that's understandable, but this is the effect of that. So I've only put 4 things up here: breast cancer, prostate cancer, endocervical cancer, and childhood vaccines. This is what has happened in April and May, and this is our county. That the diagnoses of new cases of breast cancer has dropped by 63% in April, and you can see the numbers for May. In prostate cancer, the number of new cases of prostate cancer has gone down. Endocervical cancer from pap smears and childhood vaccines. These are all one of the unfortunate effects of this COVID pandemic that we are in. And it's understandable, but the concept here is all 4 of these are elective. So remember, breast cancer is almost always diagnosed by routine mammograms, prostate cancer in individuals by physical examination or symptoms, endocervical cancer by pap smears, and of course, childhood vaccines are by routine visits. And what I've put in white across the bottom is, although we don't have these data in Contra Costa County, in larger areas, there has been an increase during the pandemic of heart attacks and respiratory deaths because individuals did not go to an emergency room. It's time for this to change. It's safe. This concept now can end. Emergency rooms and all doctors' offices have learned so much in the past 5 to 6 months that they are safe places. Go back to your doctor. Get the routine mammograms. It will look different. You will likely be screened when you walk into the waiting room. You will likely be wearing a mask. You will see the entire staff doing things that they have never done before. If you have chest pain or if you have a medical emergency, go to the emergency room. I promise you, you'll be impressed. The guidelines that have been developed for protecting you at a doctor's office, at an urgent care center, at an emergency room are unbelievable. They are overwhelmingly meticulous. And as evidence of that, although many, many healthcare workers, doctors, nurses, respiratory therapists have acquired COVID, they have not acquired it on the job. They are just general population like all of us. So the protective measures that are being done in hospitals is not putting our healthcare workers at risk for getting infected. And it does not put you at risk. We don't want to see these numbers continue. Remember, all of these, breast cancer, prostate, cervical cancer, the outcome of all of these diseases is based on the earliest of the timing of the diagnosis. So if you're overdue for your mammogram, or if it had to be postponed, make that appointment. And I promise you, you'll be impressed. It'll be like, wow, they really are concerned here. And the same with all of the things on there. And if you have been afraid of taking your kids to the pediatrician or to their caregiver for a childhood vaccine, it's time to re-up them. Childhood vaccines save tens of thousands of lives each year. And now for a chemistry lesson. Hand sanitizers. Well, hand sanitizers have become sort of a public knowledge-based product that is everywhere. So let's talk a little bit about this. There are 3 alcohols that are widely available: methyl alcohol, ethyl alcohol, and isopropyl alcohol. First, let's talk about methyl alcohol. Methyl alcohol is wood alcohol based on how it was originally produced, and it is bad. To my knowledge, there are no methyl alcohol hand sanitizers manufactured in the United States, but they are sold. They are manufactured in other countries. Do not use them. Methyl alcohol is a chemical that is to be used in industry. It is not to be used in a hand sanitizer. And like I said, I don't think it's made in the United States. It can be absorbed through the skin. It is extremely toxic. So look, particularly if you see a hand sanitizer coming from a different country, look at it and see if the word methyl alcohol is there or wood alcohol, and throw it away quickly, because it will be absorbed through your skin. Now, the other 2 are ethyl alcohol and isopropyl alcohol. And what a story of Purell, right? In 1988, there was this idea that we want to be able to clean our hands without water. And although the history of the waterless alcohol-based hand sanitizers is in controversy, Purell was certainly one of the first on the market and became a brand name like so many other things. And it is 70% ethyl alcohol. Equally as effective is isopropyl alcohol, and there are many out there that are 70 to 75% isopropyl alcohol. They are both fine. They both work. No preference of one over the other. For a long time, nothing was available, and now everything is. These are both good. Now, what happened during the time that there was such a shortage of hand sanitizers? We had distilleries and wineries saying, hey, you know what? We make ethyl alcohol. That's how we produce our product for drinking. So we will remanufacture our distilleries or remanufacture our wineries, and we'll make ethyl alcohol, and you can add some propylene glycol and some aloe and some lanolin, and we will step up to the plate and help the country and provide hand sanitizers And several of them did that, and they made ethyl alcohol. Most of them are 80% because they can make alcohol as strong as they want to, because they're using these huge distilleries that previously were made for whiskey or for wine or for other drinking alcohols. Now, and ethyl alcohol is the drinking alcohol. Isopropyl alcohol is not. Isopropyl alcohol is rubbing alcohol. But here's the difference. I get these calls like, my hand sanitizer stinks. Every time I use it on my hands smell like garbage, or my hands smell like sewage. So Purell and isopropyl alcohol, the alcohol is made by a chemical reaction in a laboratory using pure products. So it's a chemical reaction. The ethyl alcohol that comes from the wineries and the distilleries comes from fermentation of whatever product they use. So if it's wine, it's fermentation of grapes. If it's whiskey, it's fermentation of corn, barley, hops, wheat. And that fermentation creates some smelly chemicals that go with the alcohol. Now, that's a good thing if you're drinking it, but it's not a good thing if it's opened up. Wine does not necessarily smell good in an open glass of wine on your counter for a couple of weeks. It starts to get a pretty ugly smell. So what we're seeing is these hand sanitizers that were made by distilleries and wineries have a little bit of an ugly smell. Now, the smell is just an amine. The smell is not a germ. It's not infected. And it doesn't do anything except make your hands smell, but it's very safe and still gets rid of virus. So if this is all one can get, it still works. It's excellent. It replaces hand washing, but it does have a little bit of an odor. And I'm told that there are a few companies out there that are making a product where a couple drops can be added to these fermentation-based hand sanitizers that will take care of the smell. And then the last topic, wastewater testing. Who would have thought? This actually is a picture of the wastewater plant in Oakland, California. So a little bit of a background. The coronavirus and all respiratory viruses are excreted in stool. They're not alive, but they are excreted in stool. They're viral particles or pieces of the RNA or the nucleic acid. It's all chewed up and it's all broken up, but the genes or the sequences of the nucleic acid are intact, which means that you can detect COVID-19 or coronavirus in wastewater, in sewage water. Well, as it turns out, we know we have difficulties with testing. Let's talk a little bit about the PCR testing that all of us are used to. We're recommending it for everybody, but many people can't get it. Many people don't want to wait. If you saw the lines that in Arizona waiting overnight to get tested. We also know that some people who want to get tested or who need to be tested won't do it. And we're creating these percentages that Supervisor Andersen mentioned yesterday of the percentage positive of those who elect to get tested. And we want better numbers, but testing is not a mandate, nor should it ever be, but we're left to what is the percentage positives of those individuals who want to be tested. Wastewater is a little bit different. In 3 distinct studies now, sampling the coronavirus from wastewater at sewage plants can tell us how much coronavirus is in the capture area, that is in the community that is served by a wastewater plant. And it is almost always, it can be enumerated. In other words, from the amount in the wastewater, using a formula can be predicted how many persons are infected. And these would be persons who are actively infected or at least recovering from infection within the first month. And this represents a potentially fantastic number to tell us what's going on in the community. And then in 3 different communities, sampling wastewater for the coronavirus has predicted a spike. meaning that it shows up in the wastewater first before it shows up in the number of sick people. And that probably is because we're still dealing with a third to maybe 45% of the people, of the persons who are sick have no symptoms. And again, this is a function of the younger people. But if we assume that 40% of those who are infected have no symptoms, they're not going to get tested, but it is going to show up in the wastewater. So just a message here that we don't have control of this virus. I'm not going to embellish it. I'm not going to exaggerate it. I'm not going to downplay it. But I will promise you that the field of science and the field of medicine is not slowing down. We are working on absolutely everything we can to help us control this virus. And this is yet one new concept that I think I'm not discussed here, but it looks very exciting. And so, Mr. Mayor and all of you, thank you very much again. I will stop with that and we can move forward.
Dr. Joseph, thank you. That was really quite interesting. I know that Senator Glazer may have to take off to go to a Senate hearing in a few more minutes. Steve, do we have any questions that we could direct towards the senator?
Sure, yes, we do. Thank you, Mayor. Once again, everyone, if you can submit your questions to info@sanramon.ca.gov. That's how we take questions for the Mayor's Breakfast. And Senator Glazer, we have questions regarding what's the state budget outlook for next year? And are there any additional plans for state relief for residents who are out of work and possibly for rent relief?
Oh, good question. So the budget outlook is terrible. We did make some compromises with the governor on the budget that he signed last month that deferred some of the obligations to a future year in excess of $6 to $8 billion. That allowed our schools to be basically fully funded based on last year's enrollment for the year that's now beginning, and avoided some of the massive disruptions that would have occurred with teacher layoffs and staff layoffs in the middle of this very difficult transition that they're facing. So we've deferred some of the required cuts this year to the next year, and that's going to create great pressures at every level of funding in state government. So the outlook is not good. Now there is hope that the federal government will provide greater resources to the states that can flow down to the school districts and the counties and the cities. And that's not clear that's going to happen. Certainly our congressional representatives know about the need, but they require the support of the president. And so far, it's not clear that additional bailout's going to come. And that we're dependent upon that if we're going to avoid some of the draconian cuts that we are experiencing now, and we will even more so next year. We have tried to provide some protections for renters, eviction moratoriums. The Senate has passed legislation to give some incentives to landlords to defer rents from their tenants. That's subject to the assembly review and of course support from the administration. So we've tried to advance some cushions to help renters through the support of the landlord community. And we'll see whether that's going to move in the next few weeks in the assembly to make that real. And in terms of unemployment insurance, the federal government has really stepped up in a big way there, enhancing weekly checks by $600 for those unemployed. And of course, they've established some other programs for small business to provide incentives for them to keep their employees on their payroll for the last couple months. Those are phasing out. The unemployment insurance, additional benefits are phasing out, and it's not clear whether the federal government's going to step up in either of those two programs and expand them. And of course, what we've tried to do within state government, because we administer all the unemployment insurance claims, is we've tried to enhance the EDD, Employment Development Department, administrative review. My office is inundated with folks who have called and asked for help with their unemployment insurance benefits and we continue to try to help them every way we can. But the enhancements from the state have not been clear. Most of it is coming from the federal government.
Great, thank you. What we do every week is we also try to combine questions, because this week we seem to have received a lot of questions about sports activities and kids participating in sports activities. And the main question seems to be around baseball this week, and why aren't baseball games allowed? And also a little bit of a discussion about what is the city doing to enforce baseball games that are occurring, and what do we do when we receive the calls?
Great. And I want to thank Senator Glazer. I know you've got to run, so I want to make sure I say it. Thank you very much for participating. We appreciate it, sir.
Thank you, Mayor. Thanks for having me.
My pleasure.
Stay safe out there, everybody.
Thanks.
Thanks, Steve. So do you want me to start with baseball? I'm happy to launch right in with regard to that. Given the current situation and the state guidelines do not currently allow participation in sports that have close contact, and you can't have teams that are playing against teams. Right now, under the state guidelines, you are limited to that 12-person sports camp with the same 12 individuals for at least a 3-week period. And again, we as a county are not allowed to exceed what the state allows. And currently they do not have guidelines that allow those contact type sports participation.
So I'll also chime in from the city perspective. I greatly appreciate Dr. Joseph's description of COVID fatigue, and I think sometimes when you allow certain programs, all the city's programs, not even the city's programs, but those who choose to use the city's fields, actually submit a plan and actually agree to abide by the health directive from the county. And so on a few programs prior to this, there was the discussion about the need for our kids to have some healthy outlets as well. And so we're super concerned about that, but we have to balance that within the health order guidelines. And we completely depend upon the county's direction and discussions regarding that with Dr. Farentano. So it's very important to us that we stay within that. So with that being said, some groups who submit these plans sometimes exceed their what they've submitted and push over the line. And so the city, in fact, we've had it happen, and we've immediately revoked one group's permit completely. The other issue and challenge is our parks are open, and we have lots of baseball fields, we have lots of soccer fields, and we have lots of amenities that we do our best to monitor, but there's walk-on groups that come and actually participate in different activities that aren't allowed by the health order. I was even told by our Parks Community Services Director that there's a group that apparently drives around the Bay Area and just jumps on parks whenever they can, wherever they can. It's kind of a challenge, and I understand the COVID fatigue, but it's, as demonstrated here, it's very important that we are vigilant. So the city, we will immediately revoke anybody's permit that violates the health order. It's very, very clear in our permit process that what you can and cannot do. It's crystal clear what you can and cannot do. And then the city, we have actually placed park monitors that literally go to each and every park and look for violations. And so we've upped our response to primarily ensure that we stay within the confines of the health order.
Great, thank you. And I also think that we need to make sure that people understand the distinction between a sports camp and an actual competitive game and the crowd sizes and that issue. So the county does have their frequently asked questions page that has some more detailed information. A question for Dr. Joseph. Um, Somebody writes in that their company has read multiple science-based articles about the aerosol airborne transmission of COVID, but information is very clear about wearing a mask. But when it comes to air within a building with recycled air with no ability to open windows, they write, can you please clear the air? And they do say pun intended, on safe measures that we can take within the office in that kind of environment.
I'll try. There was a going back 6 months, there was a disagreement between the United States Public Health Service and the World Health Organization on the infectivity of this virus in the air. And the United States Public Health Service became extremely conservative and said that this virus should be considered infectious up to about 6 feet from a person who's transmitting the virus. The World Health Organization was a little bit different, and they were using a 3 foot, and there are terms for that. As more and more of these studies come out, it would appear that the United States was spot on, that this virus can be spread up to 6 feet away. After about 6 feet, 2 things happen with this virus. It falls to the ground because it does have mass. And secondly, it dries. This virus is extremely susceptible to drying. It's not one of these viruses that will live on a dry surface very long. So that's the purpose of the 6 feet. The mask with that is even more effective because it captures about 90% of the virus that is exhaled from a person who is shedding. So of those 10% that get through, they fall off at about 6 feet. And I'm now talking about indoor air, okay? That's all that needs to be considered. Recirculated air is not a problem. Recirculated air kills a virus instantly from drying. So you don't see recirculated air being a problem. And this was studied pretty heavily on the cruise ships, where we had these large conglomerates of infections of people on a cruise ship. And it turned out it was not from the air recirculation, but it was rather face-to-face contact or contact within 6 feet. So at least the information today, I always say that, the information today is that you're very safe in a building on the indoors if you use social distancing and wear a mask, and recirculation is currently thought not to be a problem.
Super, thank you.
Great. Another question for Dr. Joseph. Somebody writes in that they read that even if you have the antibodies, you can still carry COVID. Would that be the same case if you're vaccinated eventually? Once you're vaccinated, will you still be able to carry COVID?
Well, let's defer the vaccine question because we really don't know how the vaccine is going to work. Typically, once a person is vaccinated for measles, mumps, rubella, you never carry it. And we hope it goes that way with COVID. This sometimes can be difficult to describe in words, but let me see what I can do with this. When you're first infected, the test is positive and you're shedding live virus and you're infectious. That's during the first 10 days. So if I were infected today and I got symptoms in 4 days, my test would be positive and I would be spreading infectious virus. After 10 days, it's common for my test to still be positive, but I'm not infectious. What we're testing after about 10 days is viral particles that are not contagious, but I would continue to carry them. My body is killing them from antibodies so that they don't infect other people. So once the antibody turns positive, which is about 7 to 10 days, The nose test, the PCR test, can still be positive, but a person is not infectious. So much so that we permit them to come back to work. So the antibody is a good test when it's used at the right time to help us identify that people can go back to work, back into society, and we even let them come back into the hospital to work as care providers. I know that's confusing, but I hope it helps. First week, PCR test means you're infectious. After the second week, the PCR test may be positive, but you're not infectious.
Steve, we have time for one more question.
Sure. Here's one that's I haven't heard before, but are ozone generators effective in cleaning masks?
You probably want me to answer that, right?
Yeah.
I'm not.
Yeah.
Well, so the cleaning the mask concept is very muddy. First of all, we have to start off by, is it even necessary? Ozone does kill viruses. So if one has an ozone generator and you use it correctly on a mask that is not destroyed by the ozone, that's O3, which is a little bit of a toxic molecule, it will kill the virus. If it's a cloth mask, works very well in a washing machine as well, or just rinsing it out with soap and water. So the answer is yes, but very little practical use.
Great.
Great, thank you. Thank you to everybody for joining us this morning. Joe Gorton, thank you so much for your leadership again, of course, here in the city. Candace, you guys are, every day seems to be a new adventure. And again, thank you for your constant contact and your feedback to us. We really appreciate that. And Dr. Joseph, today was another day with lots of new information and new insights that was really, really helpful. We appreciate that. And Steve, of course, thank you for coordinating all this and to bring it all together. And hope everybody has a safe weekend. Remember to use your masks, remember to social distance, and use good common sense. Have a great day and a safe day. Thank you.